Thema, Yedima, yes, Yen Kamasano, what 3 John 1 to Eka. Or say, beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. God is interested in our health. Inti, or say, Sanya. Yen crown prosper, just say, Equanim, Ebrosun, and say, Yakum within Zed, and also Cosso. It's the way be there. Oka and the Asheme, and they will say, we have some responsibility. Your Jumedi Bidi, and I remember, your Jumedi Asudi, your Asudi, because sorry, any come by where more than say, you have a grandpa. Senya, when you are sharing from Bible. Yakupona so say, Senya, yen so, yen crown, air quantum, Sasuna, say, yen health, and quantum. Now, Bible has we now be the house in Yamawa. Na me no wako ni Solomon ekan na wenya itiase bi. Okay, so the next slide. So by way of introduction, we here discussing the introduction near the natural history of disease. We are the main topic for the day, chronic diseases. Now, Ibisa says, so what should we do? What do we have to do? Then SCA, and then we conclude. We know over here, Ecclesiastes chapter 7, verse 15 to 17. Asana, Ibra, Asana, Akasana, Bajo, Yeko. So Solomon said, I have seen everything in my days of vanity. There is a just man who perishes in his righteousness. Solomon said, we won't be bia ewo denda we dino ewa asasi so. We won't be bia. Na ye wo bia oye perepere ni ti se me ene wo ye wo ye homoden se be the person has perished in his righteousness. And there is a wicked man who prolongs life in his wickedness. Into way of contrasting, you will be or yet just and so next one that I'm going and you will be a more than and so next one that actually Solomon Niamu and all share to us. Do not be overly righteous, nor be overly wise. And I'm santi. Men yet name too much. That does not mean say but idea be your person or share. Nor be overly wise. Why should you destroy yourself? Adenti, it is said, BBAC. Now they also have a share mountains, we now watch your home. Now why it is said in Jesus Christ or ye reason tia audience are there anyway. It is our year, Nasa Kunya, Ushuga dropping, Nasa Ua. Solomon Eka said you were not wise. One finance and found to aware. Do not be overly wicked, nor be foolish to us. Now the last one is very important to me. Why should you die before your time? And Sasem when we do deep. Now Mama who said, Sasem na nkofo keka say Yakupon ma obia 17 ni eboro so 18 na nyame. So yes, there is time there. There is time there. Yakupon washye dia ma obi bia ba yenim. Tama, Yamia Shaman by 17 I used to be so the how many years? Yes, would have years. The journey is for our time and I said, we know. It's been a main room I use. But point to this said, there is an appointed time for everybody. But Solomon said, why should you die before your time? Your time is your time, and your one that's a time of the month, but your media month. I didn't see, and you are dying before that time. So this is telling you and I catch them and will say, nature said, hey, possible say, time and your media show. Because one finance some fan to unity, who will before the time. Maybe what's the answer? So this puts a lot of responsibility on you and I. In tandem with 3 John. Say, and you said, yeah, preset, you bear, as you put in every effort. Now it's me, you young and what they so, yeah, let's answer. You have preaching the baby, yeah, to us. So we are here, so let's continue. The problem, what's the problem? The problem is my people are destroyed for lack of knowledge. Inti, ye nim debi. Inti, ye tre, ye mbi. And no one go hospital. And I rush it will be about me. I said this week now, me, yeah, you might hospital to really be some other Juma war, baby for. Now, we go to hospital, say, we call my father, and now, me say, and the friend say, case be about. Now, me, I'm yes, I am man war hospital. Now, a case, young guy, 27, 28 years. And now the other sorry regional for 2 days. Or say over that. But you also want to know. Now, I didn't say regional. Wow, very how many times 30 minutes to grind and 1 hour. Now we did 2 hours, 3 hours, 4 hours, 24 hours. Now another 24 hours. Still. And so I did a friend of prayer person. I didn't know it's very painful. Now, say it lasts for more than 6 hours continuously. Not eventually, your man not ever form, you will not be able to get a strong erection ever again. But waiting, I sat for 2 days and it still counts. I went to counsel this guy, and said, I said, you will appreciate me. Now, I'm diverting Mujana image in the Echo Baby. Men, one of yes, I did go hospital. And I'm a church, and home, a baby, Pajatu. You say, okay, no, I'm a fan of good theater. One of the theater friend said, guy, you see on your operation. Why? Because on any uncle, I casa, I'm an uncle, the catcher is spiritual. Uncle Phil. I said, what? Now I go back. And then I go Kasaya, and then I kind of also I say spiritual. Now, 2 days, 3 days time, 4 days time, whatever. I then best start to say, you wouldn't know say, and you human being, it will go gangrenousness. Say, bro. What's the name? It's one of the complications of such a thing. It's ever prone if you ever banana I see contraction. Now who was that? For lack of knowledge. So there are a lot of things that you face, you go through, you suffer, you brew just because you need and we need the ATM. So Ghana for the BBI, like I said, no, so Yamina catch them say, me who was you, me who were one finance and I'm found to say, indeed, your responsibility. So the objectives for discussions to be empowered to take good care of ourselves or our lives. the life God has given us. It's a person, if you are also ye, na nkwana nyame di ama ye, yetumi ebɔ mobile. Now it prevents you from dying before our time, just like Solomon said. Then to keep ourselves alive for our dependents. You want to depend on you so to survive. Who are mama, who are papa, or other emotion for on say one part on to me. Movement will be away on my sitting on the school corner we can reach now also. Now, Yafa 7 years and na Yabetri Yampan. We've disappointed people. The baby now perform a brand why basa. Okay, that is so important, sir, if we stay alive. And the last but not least, Bible says, Jumedine Dawson. Jumedine Dawson, baby, and so someone. We are before our vineyard, almost so. Why should we die? To further reduce the laborers. It doesn't make sense. We need to put in so much effort. Next slide. So now I'll take you on a journey. Journey now, me no be femino. Ade a message say what do I be di echi pa na what say. In fact, say me slide this particular slide you should be able to understand how I will be to me in dealing with yare bia ne amokeka. You should be able to. This is the natural history of disease or diseases, most diseases. Okay. You can't yen as limpa. Really, say if I say you can malaria, okay? If you have malaria, and tontum encow, into tontum encow, a chese, and tontum embua, na malaria one, the be new mojem, and I'm one. Obia or Ebia, South Africa, Kenya, Nairobi, or America, or Germany, all those places, whether they are very cold, survival. So people like that, they are not exposed. Okay, they are not exposed. They don't have a problem. None of them they don't bother about malaria and form because they don't have any risk. It's a car risk card. You can't adhere say a particular population a bit me ayo but I'm not in the Inti or US or Germany and malaria no problem. One damn okay. Inti those people they are not exposed. What about Ghana? Communities they are highly exposed to malaria. In fact, Ghana, we are moving away from malaria control to malaria eradication. In your particular communities, Greater Accra region, we've been able to get to a particular marker and on here about eradication. Let's just say malaria above form significantly to the point that we can talk about eradication and not control. But a lot of us, we find ourselves in a malaria-prone environment. We are at risk. We are exposed. Every now and then, we call for that. But then I'm saying we have good immunity against malaria. No problem. Now, say in Tontono Ekau, you are exposed. But one yare, it's a boa, was subclinical disease. My from malaria and confirmed to change. Young fan said breast cancer. Breast cancer. Obu breast cancer waha. So when you're a technical person, a very early cancer. Now when you're a technical person, so bear sharing the phone, no one picking up. Oh, only problem be an moja mfine nufu many number problem be but abanu won ketwa nti abanu won ketwa na still no man problem bia no ye ka say ni pa ko no sub clinical disease a che yare ni impie but say yare ni pia na che ni pa ko nya clinical disease wonya yare be ka say sia ni pa ko no has breast cancer. Then so breast cancer na say no so anya ho hwea, then you get the complications of breast cancer. Now when you have complications now, then and also you are now. What's now here? That's how they come. Now we feel that as fast as. It's yarea. For most yarea, I dare say yarea in Ansanet. It starts from a time you are not exposed to the yarea. Then you get to a point where you are exposed to the risk factors of the yarea. Then you get to a point yare now starts, but kit. Then from there it gets to a clinical stage where yare now have full blown, unya symptoms. Then from there we get to the complications, and then from complications you die. Sana most yare gets it. If we are talking about how to deal with yare, as I would say, sir, history as what is our history in Asia? Then we'll be able to interrupt yare at whatever point. Inti, you can mention any yare, or people yare hypertension. Now, people who are close to me are hypertensive. There are people who are close to me or once I have the risk of hypertension. Me need hypertension yet. But enough say be a papa me man will be, and I'm auntie will be, and I'm uncle will be. Then it means war risk. It means I have been exposed to hypertension. So I cannot call myself as not to have been exposed to hypertension. Maybe will be the second one. I'm exposed. I've been exposed because I have the risk factors. And yet, say you are hypertension a risk. There are several other risk factors. In fact, your other conditions and then we have other risk factors like diabetes. Hypertension, they are cousins. They work together. Can get ECGRA. Can easily get one is the risk factor for the other. Diabetes and see a risk factor. Then maybe I want to so you almost every time don't engage in any activity. Yeah, you use the word sedentary lifestyle. What one day our market, shopping mall, wow shop, but they be out now. And now you're a banker. They be out now. Make our bank be Nancy and one of the bank pay for no trema when I was in JSS. It's a bon commander or can't weight loss of answer. And I make us say, oh, me buy and me say movie kakra. No say only printer. And I'm say it's good. It's good you don't have a printer on your desk. So that when you want to print, you issue the command print and then you get up. No, I'm sorry. Now what from where? You need to train your. You have to tell them. Go about castle now. I mean, one the menu printer. I mean, one a health here for your health sake. Make more printer. Sorry. Now, cover. Oh baby, it's important. Bankers, steady be on bankers. And you said they are at a very great risk. I was managing a bank or a bank manager your friend DVT, deep vein thrombosis. On your plot, or people with computer or on sorry or could you cry now? because or nyoma to clear or so clear the desk until they don't eat. You understand? Like that. So that's a big risk factor. Won't hear a lot of movement. And maybe a workers are so good. It's enough of that. So if you are in that kind of category, you have the risk factors for developing hypertension. Maybe at the point here, you check your pressure, normal. Then the disease will progress to a subclinical disease. A subclinical disease now, because a subclinical, who need symptoms here? Just like any entity. Very likely to be any symptom of hypertension. Say, would see power, and things like that. But what starts to say when that means that you have clinical hypertension. But for most people, they don't have any symptoms. But pressure was strong. So if pressure was strong, now we need symptoms. We say you have a subclinical disease. Into a subclinical disease, what we do is to screen. So when we screen, then we decide to treat. Okay. From there, we go to clinical disease, where you have full-blown disease with symptoms. Then we manage the symptoms. Now, so hypertension. Na negotiate pressure in the hall. On akasa so you'll be very menial jobs. Ijuma require amoding, things like that. Or exercising or fine. It is such a person, but even that, where you're Bearman, by virtue of you being Bearman, you have a risk of hypertension. Because men are at a higher risk of developing hypertension than women. And by virtue of you being Bearman, you have a risk. And by virtue of you being an African, you have a double risk. Because Africans are at a higher risk than those in the West. Imagine where Africa, Ghana, where Burma, whilst we be our own very active. What mommy and our papa were hypertension. And yet, double, triple. So chronic diseases or chronic medical illnesses. So we have CDC, Center for Disease Control, America Forum. So we have a definition for chronic disease. Or say the area our for about a year and over. Okay. Unya malaria 3 days. We will show symptoms this year and you treat to now. Why fine? Typhoid, acute illness. My hospitals will be bad now or say, Doctor, the whole week now, in there Wednesday, I started last week Wednesday, now said, malaria. Malaria is an acute infection. Malaria 3 days. When your malaria does wet in the mechanism, it's something else. It's Yarabia what it is. Yarabia what it is in history. Okay, it's your first idea. It's your say. It's a condition that lasts a year or more and require ongoing medical attention and limits activities daily. Limits activities of daily living or both. Okay, it's really no. See, I can about chronic diseases. It's diabetes, hypertension. It's all hypertension and our so I don't think say if we drop in now within a month in a call. But you're not on over. But what's the mechanism? My punch said you a package. You have it until you You have to get that understanding. And no, because today, they are what's your problem? For 4 minutes and a tablet and get one. Please. So, man, James, I said, today be a man bedroom, they be a man bedroom. No, so they be out. 3 times a day, twice a day, actually so once a day, you are covered. And you don't complain. Do you complain? Say, the other na DBS who complain? So if you got into the point where you need to stay alive, Solomon said, let's be wise. Until I see it to me at Nas, dear, Nas say tablets be the SCF Yemen and the Koya Yemen wine. Let's do that. Of course, it's not all about the tablets. It's not all about the tablets. There are so many things in dealing with a particular condition, even hypertension. It's about say, even say first time now the pressure that was so kakra. It's here the story now. It's me to put the person on some regimen now that kakra who are even money group said na ama need to me other who are one to me other no ama ISA, you know. And I said, you have more other medication be and I bet sure exercises be some relaxation and your man maybe your relaxation therapy sir. Say be a papa waits now where I'm starting now me taking it through. Or better here. Or better. Or you'll be on to me down. And so we start talking and I take the man through some relaxation therapy. Amen from a son can we or better here. All of these things are available for us. But we also who are the problem in Kuntumenda? To Kuntumenda, both somebody was setting whatever starts not from. Now we're increasing. Just I want to you want to work around this particular pressure. Because normally, your blood pressure, normally basal level, whoever from, but start to say we're engaging in activity, which is normal. It's in our hospital. You expect to say, Ubetina Sikaka, now Warres Sikaka, Sanya check pressure. But what else? Yes, I want to because you see another hospital said, I will hospital and not for him. Namidi, check the pressure and was you know. And yes, happen. They be okay, to hospital, I relax. Now what's now? I relax. And now, boom, food nurses need doctors in too much. Bone cell pressure almost every time I will go down. Now, the thing is that if you have the risk factors, not say pressure, a posture, and starting from Balabri. You know, at one point, the pressure will get the bed. In fact, because one time hospital and was through, but wouldn't name. It's at one point to the hospital, near C was through. Then people will argue with the doctors. Doctor, made the pressure name so. No, maybe something, no one pressure on one on the one of the raw pressure. It's at one point in your life, and our pressure bed, ever was pretty, sir. At a point, now you catch yourself pressure now posture. Just listen to Dr. Man clinician near Ubet Miaye. And I Ubet Miaye, I catch your why now it's me about. That is so important. Major chronic diseases are your heart diseases, including hypertension. Okay, it's your heart diseases. And one of most times there is stroke in Edinburgh. Then your diabetes, your dyslipidemia or hyperlipidemia, near all the cancers. Okay? Now, say, opinion stroke, na the component can be added to an ameba. It's a good another and any other come. Now, almost your mom hospital, John Boko, up a it's a hairbound, so we won't be back on the Bibi Astra and some. And I'm almost added. Mamma, near the Arabia Astra, the Bacon and some, and I maybe I. But you see, if you know the anatomy and physiology of the body, stroke, and yet body, that part now says I'm a problem. You're on a problem, no. Maybe Manchester spiritual. You're on a problem, no. Problem they are in a brain, or not problem, no. Because brain don't have controlling body parts. Okay? Until say a particular part of the brain no parts be a nyamoja. Just because if you are in any moja a blocking, and I say in any moja a pipe baby, Intiama effectively the moja to me not that part of the brain, no. That part of the brain, all other parts of the body, all parts of the body and that part of the brain are controlling. And you man. It's your many strokes is here. The side na eye weak still walk near fine. But with time, because a cancer power in him now won't move in here, if he has started shrinking. That's what normally happens. It is so many babies, Sasha, or pass now eye weak now. If I'm not you. No, so Ghana 4%, almost a baby. Extra baby, eye weak. You better you know, answer me now. I say it, yes. Once 1 year old baby, 1 year. Okay, so knowledge. Okay, yeah, no, you're training, and a man will be training. You're papa, until you be a young mama, why when you say you say, your papa from the sea, who didn't answer. Yes, she's inside me now. I catch the one. I am Munjindi Kakara. Now it's me acquiring. It's so important. It's heart diseases. So many of them. Commonly, you can hypertension. But there are so many other heart diseases. Heart nakasano. It bet me I kesiye. Na maybe a muscle. Man heart muscles no. I think. If you saw now. I dilated, I have very thin. Problems maybe. And there were coronary artery diseases, there were in heart, and also a commanding in wall, not a beer blocking. There were atherosclerosis, there were in a body parts, and also a blocking. All of those things are part of heart diseases. For but one for we need him film. We see empire. Then you walk Isichiyari, and yes, it's in a debate, but your body nakasano, sugar, your friend of glucose, glucose no, and yes, it's stay a moja. Who did dear, who did full bankum by a more? If you are not bedino, a call you from one, now you from now call soon, a breaking in our down into glucose, now glucose no. If you want soon, I call Moja. Majo follow. I call Moja and yes, it's still Moja. Moja is a transport medium. I said, Moja move up and down your body. Now, sugar and a glucose, then aurora or body tissues, maybe our liver or muscles, and then we can count aurora parts in the baby. But Sonia is a area. Now, so type now, insulin war now. Insulin war, we'll say it's changing now, Mojan, to make any free Mojan, and body parts. It's a problem. It's a insulin war. But, and I'm saying, body parts now, I said, insulin, sugar, policeman be ginger, or say, penny arada, sugar, no chemical. That type, no, any friend type 2. And no, you have more tablets. Okay, tablets, I have one, the policeman, if you want sugar into me. You also have more type 1. Most times, the younger people. We are struggling with one child, 10-year-old, or hospital, also, when you have diabetes, type 1, and also insulin, and I see insulin treating. That's how it is, okay? That's how it is. And then your dyslipidemia. Now this lipidemia and hyperlipidemia are something big. Ghana especially because now, well, good. So people are getting so conscious about their health and their body shape and size and whatever. And I'm saying, unfortunately, people are ill-informed about how I'll make keep on shape and on body, on weight. They rather engage in some wrong and wrongful activities via on dream no and mark lose weight. In fact, a particular there is this lady here now also within Within 3 months, she lost about 12 kilos. 3 months. Now if you lose 3 kilos, no, yes, weight not perform, but if she started having issues with this lipidemia. Because now people are on keto diet. Keto diet, tilapia, nkwana, oil. Nti only carbohydrate be a tilapia na vegetables, and one is oil. But so what say? How what to do a juma? We don't say your money go away totally wrong. And now therapists need go over and yet blankets are what will work for will totally different from what will work for another person. So clinical dietitians they will look at your body type. On better or labs, on better or body no makeup send it. Not what me prescribe what will be useful for you. Even exercise. Also be a treadmill so cardiac arrest so treadmill. Also person treadmill eco now the exercise. So be a wash. Exercise. Inti exercise also and straightforward blanket exercise so be exercise and sometimes here doctors we have a problem because we just communicate say yeah we have more exercise question. If you are exercise what kind of exercise should the person engage in? Go exercise for exercise know your types of exercises. Your duration of exercise said ubiaye pen pakono the body type. And ne cardiac health. That is also another big area we have to discuss sometime. So important. All right, here to us. Next slide. So major risk factors into yakasa about poor nutrition. Eduania yeti. Into eduania di enye. Miakasa eduania di enye. Because miakasa ya get confused about eduania mi. Timetiwa na accommodate. Na time also mba, time also no. As a person who and afra. You understand? Things like that. If we want to keep healthier, a lot of things in kakra. Men free asiana unkoye something big and yet sustainable and able to me your health. Your uncle they decide they say on the exercise. And every day they are exercise. Now they have joint problems. Young person or joint problem. Who are now your mamia when you feel maybe I want your menopause 50, 55, 60, thereabouts. Now who better we exercise? Man can now play jogging. It's not because say your obesity age, body type, cardiac health, and a number of factors in the designing the kind of exercise just walk keke. Nanti keke enough for some people. Young people to say mean say who are a juma keke ne jogging sir. Into mimpo se me kasa me person here jogging na. Even though I'm young, I don't just start to jog. Start to say brisk walking keke. Okay, brisk walking keke. Then it's enough. Say, you do brisk walking, or China do brisk walking. Who say, oh, now no, wakuma no, accommodate here. Then in Kakanagra, in a graduated form, no, they will increase in it. But I saw a young person, so who say, oh, a young guy, see, me go to a bika. Ubenya, wakuma besizi, yenyanwa. So all of these things are so important. So physical inactivity and then excessive alcohol use. It's really no. In fact, also research possible every now and then. Yeah, now we are in the medical field, no, and now we are more likely to be privy to the current research findings. Mono research finding be some years ago, 1960s. And Momoka said, oh, moderate wine is good for the heart. Several years ago, like 1960s, and of course, our research, you know. You see, I do research about actually said there is no safe level of alcohol. But what's in our time? There is no safe level. I say I should preach on. There is no safe level of alcohol. So don't confront yourself, say, oh, me person they are hiding behind that to drink. So no safe level for your heart, for your liver. If you take alcohol, then your heart is getting weaker and weaker and weaker. And I see it. We see it every day in the hospital. Okay, Mr. Take care of yourself. It's so important. So what do we do? You know the natural history of diseases, no? Then it's first education. So we talk about health education and promotion. So we are educating ourselves like we are doing now. You see, say important say give it to me. Yatina say healthily because say when you one year lucky now when Sanam can be. We are going to be able to it will not happen. But what is the hello? Now, so far, the majority of the people who die, they don't die in their sleep. So don't comfort yourself saying you die in your sleep. A go home for a long time. No, I hear a burden to another son any family. Some secondary school people will be able now SS for no chase your senior speeches now your own boy for free a friends back on the from not in the war. Now immediately the guy your friend of quadriplegia. Just the spinal cord now the level of the neck got truncated indeed. For the rest of the guy's life, no surgery in the world can save this boy from walking. And yes. Now, just think about it. So this child here came here, banker, pilot, engineer, not the one in my name. Medicine is too stressful. Or the one in my name, the guy's life has just gone off. We have to send him to Kolebu for surgery. Surgery, Kolebu, see if they don't have 40,000 Ghana cedis. That was like 2 years ago, 2-3 years ago. How many 40,000 Ghana cedis are? They cannot even admit. As if that 40,000 surgery, is going to make the guy walk. No, it's just going to stabilize the neck. That's all. I don't know. So now the guy had to surgery to stabilize the neck. Just the neck can be to say now. They started to me moving and now to me move. Now going to me controlling the bowel movement. It is here in perpetuity the guy is going to be in a wheelchair. Whatever. And these are things people are going through. We have to be wise. Okay, so please, problem at doors. Chronic disease is not here. Like I've said, if we share or risk factors, some of the risk factors you can deal with them. You bet me your own baby. But go how we all share any. We are Burma, won't mean change your sex. We are African, you can't change it. Which may if you have but now you are still we are around you. You can't change it. So you are who you are. And to know your risk factors. Risk factors in a most times like I said, they are not addictive. The risk they move in an exponential form. Until risk it gets even more dangerous. It's Mr. no wedro say do na wo no e ma issue bi a mesro bra hospital talk to us near finding the best way out and a bit me about who need arena go to the hospital, go to any sometimes pharmacies scrap or they check BP and things, go to them, let them check, let them screen for sugar, diabetes, any other can patch up on next slide. We are rounding up. Okay, see. Alright, so I even put these things there. So the first one, nutrition and things. Move to the next one. And then for the second one, where you are exposed, for Yaren Power, we have to immunize. If you've been exposed, for example, HPV, if maybe you've been exposed to other multiple partners, you need to go for vaccination for cervical cancer, for especially the young ladies. Okay, we have hepatitis B screening. Hepatitis B is also killing people. So go for hepatitis B screening. When you're negative, go for the vaccine and make sure you complete the 3 doses. It's so important. Okay? And then for those who are who sell food and things, hepatitis A screening also for you, because I don't know, it's transmitted through food. Okay, so that's also important. It's one of the things Okay, but these are immunizations available. Malaria now, we are doing some malaria vaccination, and so I don't think you do Western region, but elsewhere it is happening. Okay, tetanus vaccination for pregnant women. Yeah, once you've been pregnant and you've gone through the system, vaccine, you need to continue. Next slide. Then the screening, these are basic screenings. Fasting blood sugar, random blood sugar, we have blood pressure checks, cervical cancer screening for young ladies. Now, we are doing the screening. The protocol we are using now, we are doing the screening from 25 years. So when you are 25 years and above, please try and submit or subject yourself to cervical cancer screening. So that the BS starts here, you need to be on in terminal. Then we have self-breast examination, breast self-examination. For your power, and at least once a month, examine your own breasts. Now, what is our breast on the architecture, etc. Once what time there, say change which we are picking up very early. Now they are at the hospital. Apart from that one also, models at least once a year. Go to the hospital, take I think say October also is a breast screening month. Yes, take opportunity. How many screening we have normal checking, or go to the hospital and let them check. We have colon cancer screening, and also for men. Okay, usually men 50 years and above, you should do colon cancer screening. Okay, your colonoscopy, your cord blood test, all of these are tests are available. Your PSA, prostate specific antigen, and also a screening test. That's elevated. Doctor Eno Kasa or shall risk factors, so which may I recommend a prostate scan for you. Now you will afterwards. Your sickling test, and also your HB electrophoresis, and also SOE. Mr. In Barney, especially man, please don't do sickling test, do electrophoresis. I know what I'm saying. Sickling test, you're fine. But sickling test, it only picks sickling, the S gene, or picking any other abnormal gene. Or picking S. But in Ghana, we have C also. I have people on my sickling test and they're negative. Or just say, they're negative, they're just normal. No, I can't share Obama, the sickling here positive. Okay? And traditionally, we are sickling negative. Now we should be a sickling positive. You see, there is no problem. But there is a problem. Because if we are sickling negative, though, maybe I will see. Into will see, now we share Bema or S. Now, SCA, that is a sickle cell disease. It's from bad there. Young ladies now worried there. We are quite AB like viruses. No keep it. Bema be a which you are catching some funny there fraction. Very important. Treatment. So the treatments are a war for disease again. It could be orthodox. Okay, me I'm a family medicine practitioner, and family medicine we inculcate all other treatments regimes. Okay, not only the orthodox. If because we are baby nakuma na so wakuma then we direct you to the right thing. Okay, but apart from that, your other treatment modules so are complementing the orthodox treatment. You'll be able to say chiropractic practice. I know usually they look at the spine, and it's helpful. Okay, if you can access their care, it's also very important. Okay, or it's good. Okay. Then we have the orthodox, the medical, surgical, we have the psychological treatments. They are all available. But of course, so when you have surgical problem, man found herbs. When you have any also, as you may call me, do not have any idea of the strong. Any idea won't soon. It doesn't work. Okay, fibroid, it doesn't work. Fibroid, and yet, well, fibroid, now, while Casa, I do with me, and now, as well. Fibroid, and into me now. All right, next slide. Okay, so rehabilitation, if the thing gets complicated, these are all rehabilitation things to improve the person's life, okay, quality of life. Will be stroke, who are not affecting the speech. We try to do some rehabilitation, able to improve the person's health. But you can those areas. You can now you're complicated, then we are talking rehabilitation. Okay? You can say to me, you catch disease no, at the very early stage. Then we are fine. Okay. So we've ended. Next. So conclusion. You are responsible for your health. Men found question yamen. Konyame waye nyobitumi aye ediama you and I. That is not to say Senyakupo Pesoye Nadia will be able to match trade. Nanyame Pesoye no will obey. But I don't know the Yaminasa. But Yamin Ama, you and I, the power to take care of our health. Nibdia I able to be a DISA, it is readily available. Okay, it's in Yampon Shrine. Now on wine. Now we no asset. Now and why empower enough. May it be living health. Amen.